Greetings to my dear friends. In this video, just like the previous ones, I want to talk about an important point, one of those common mistakes or, let's say, widely used errors that are prevalent among people, but most of our dear friends aren't aware of it. So, we'll explain it, as the saying goes, once and for all, so they can rest easy knowing they've mastered this topic and understand it. What is that important topic? The summary is this, the headline is this. It's better if I pick one that's the most common to talk about. A headache isn't a disease. My medical colleagues in the medical team know what I'm getting at. They've already read my point, so let's set that aside and explain it for our other dear friends, office workers, engineers, teachers, homemakers, accountants, laborers, farmers. We want to explain it for the rest. Those who don't know. See, in medicine, we have symptoms, we have signs, we have diseases, and we have syndromes. These are all separate things. What does that mean? Complaints are actually what the patient is reporting. For example, they say, "Doctor, I have a headache," or "My stomach hurts," or "My back hurts." For example, "My mouth is dry," "My eyes are dry," "dry eye," for instance. None of these are diseases. These aren't the names of diseases. We don't have a disease called dry eye. We don't have a disease called headache. A disease called, these are symptoms of diseases. I just wanted to say that. So we shouldn't expect to tell the doctor, "Doctor, my head hurts." And then what? Some people jump ahead, they skip right to the end. What should I take to get better? Meaning, my head hurts. Give me medicine right now. Well, look, we have things like painkillers, right? Painkillers, their job is to provide relief. It's in the name, they provide relief. They don't actually cure anything. They're just part of the treatment plan. They'll say, "Hey, my back hurts. What should I take?" When you say back, that back itself has dozens of components inside it. Then you go to the doctor, they examine you, investigate, ask questions, and only then do we realize, for example, that the poor person's side was hurting and the whole issue was actually their kidney or, say, their gallbladder. Just because there's pain in the back or the lumbar region, it doesn't necessarily mean it's from the spine or, well, even if it is skeletal, right? It could be the bone, the joint, or the muscle. We need to figure out if it's a muscle spasm, the bone, or the cartilage between the bones. All of these are different. Got it? Both the treatment and the approach, everything, like how we should handle it, what kind of imaging or tests we need, and so on. Headaches. Hey, my head hurts. Well, this headache could be from sinusitis, it could be from high blood pressure, it could be a vision issue, it could be a tension headache, a stress headache, for example. It could even be a brain tumor. Right? It could be so many things, from something very simple to something very, well, serious. There could be so many causes for it. See, we don't want to just give painkillers. We don't want to just provide relief. I mean, we don't want to. When we first go in, we need to figure out what the cause is as soon as possible. What if this patient is, I don't know, having a brain hemorrhage? Are you following me? Some things could be emergencies. We need to know, to figure out first what the cause is, what the root is, and what the diagnosis actually is. So, first, the patient's complaint. The patient comes in. I've already explained in a session about this very topic of taking a patient's history and the chief complaint. I hope my dear friends who handle the editing can place the link above or below this video, so if you haven't seen it, you can go check it out. The doctor assesses the patient, performs an exam, and takes a history. Then, they order paraclinical tests, like lab work or imaging, to help with the diagnosis. Other diagnostic procedures. They need to be done, and then, if necessary, a diagnosis can be reached. Once the diagnosis is reached, then they start writing out the prescription. At that point, when the illness is known, the medication is also clear, and the right medicine is prescribed, rather than just giving painkillers. So, my request is that by just stating the problem you're having now, or your chief complaint, don't assume you've given the doctor all the information. That's just the beginning. Don't expect the doctor to start writing you a prescription before they've made a diagnosis. Please. Please. I'm saying this because these are things that doctors would love to tell you, but they either don't have the time or haven't gotten around to it yet. I haven't seen it anywhere else, so I'm saying it now on behalf of my dear colleagues. So, that's one point. I really wanted to take some time to explain just one or two medical specialties in each of these videos, and really dive into what they're actually all about. The main reason for this is that the overall plan for these videos is to help raise the level of general medical knowledge for the public, and to do that in very simple, easy to understand terms. It's all about making complex topics accessible for everyone. That's my goal. To raise the level of medical literacy in the community. The thing that, as the English say, tortures me, really tortures me. Maybe I should even say, perhaps I could say my main motivation for starting this whole thing was these pseudoscience posts, what they call yellow journalism posts. I mean, it looks scientific, but it's not scientific at all. It's mostly just tricks, deception, fraud, scams. It's got everything in it. Take, for instance, simple fraud where someone just makes up nonsense, as they say, about a medical issue, just to get an audience, followers, or I don't know, members or whatever. And people who don't have medical knowledge, and even those who have a little bit of medical knowledge, I've seen them get hesitant about whether it's true or not. And those who are smarter are the ones who ask the doctors around them if they have any in their family or close friends. They ask, hey, is this true? Ask. Don't share these posts on WhatsApp, Telegram, or, everywhere else. If I were to give you a rough estimate, if I told you that 60 to 70% of the medical posts you see all over social media, from Instagram, and I don't know what else, WhatsApp, Telegram, Facebook, and all that, are this kind of clickbait, would you believe me? 70%, 60 to 70% of them are clickbait. I mean, 7 out of every 10. And then you take the time to read them, hoping to gain some knowledge, to know what you should or shouldn't do, and it ends up being the complete opposite. Meaning you get misinformation, and you end up not doing the things you could do, and doing the things you shouldn't. So you've read it, you've spent the time, you've gotten misinformation, and you're paying the price for it. Because the things it tells you to do or not do, those do's and don'ts, are wrong. Sometimes it's actually the complete opposite, and that's really dangerous. I mean, they're telling me to do things I shouldn't be doing. This danger I'm talking about happens in everyone's daily life. I mean, because of following a bunch of these, fake medical posts, their lives and their problems, their illnesses, and so on, got way worse, and it caused them some really bad side effects. We don't know who's spreading this stuff. There's no accountability, no follow-up, no oversight, and it's become a market where everyone, just to get their post or Telegram channel. I've even seen it. It's really interesting. Before I wanted to start this project, I went and did some searching myself. Just casually, though, on the surface, not really in depth. I wanted to see if there was anywhere doing it. If there was a place providing information, that was. I saw that no, they're very rare. There's one that's new and doing some really great work. There's a collection of Telegram channels I saw that are doing exactly what I'm doing. But I'm really bummed out that their audience, the members of their group, aren't very numerous. Now, I don't know. I don't think they've been at it for very long. I'm not sure how long they've been doing it. This work is important. This work is necessary. We need to raise the general level of medical literacy in our society. The average needs to go up. This is one of those things that people need to know. Right now, our people's economic literacy is, mashallah, pretty good, and their political literacy is, mashallah, very good. Now, their medical literacy needs to get better too. Anyway, sorry I had to give that extra explanation. Now we'll go back to those 2 or 3 fields, and I'm keeping an eye on the time so I don't bore you all again. To those 2 or 3 fields that I wanted to explain in this regard. I want to talk about that same topic of internal medicine specialists and their subspecialties, which I touched on briefly during a previous conversation. Now I want to explain it a bit better. See, a general practitioner can then go on to specialize in internal medicine. The internal medicine specialty, its actual title is the specialty of internal diseases. The specialty of internal diseases, or in English they call it an internist, or rather, it's that, the stuff that's in our torso. I mean, if you were to cut off the hands, for example, or cut off the head, leaving the neck where the thyroid is. Right. Cut off the legs too. This stuff you see in the torso, mostly, well, if I want to put it this way, I agreed to explain it in simple terms. So, my fellow doctors, please forgive me. So what does that mean? What do we have here? We have lungs, the respiratory system. We have the liver, which is part of the digestive system, and we have the stomach. Then the small intestine, the large intestine, and here we have the spleen. Then there's the heart and the circulatory system, the blood itself, the kidneys, and right here is one of those mistakes again, like Boragin and Burjand and Boragard and all that. It's the issue of the kidney disease specialist, meaning a nephrologist, and the surgeon specializing in kidney diseases, meaning a urologist. Please, I ask you not to cheat on these two. Don't look them up. Don't Google them. Tell me without Googling. Leave a comment down below. Who knows what the difference is? Anyway, we were talking about internal medicine specialists. So, an internist studies for 4.5 years on top of being a general practitioner to learn about all the diseases of the respiratory system, the cardiovascular system, blood diseases themselves, kidneys, the endocrine system, the digestive system, and rheumatology. Oh, another one, rheumatology, a rheumatologist and joint disease specialist versus, say, an orthopedist and bone and joint surgeon. I'll explain this to you later, too. These all have some overlap, but they're different from each other. For example, what's the difference between a cardiac surgeon and a cardiologist or heart specialist? The person who does an angiography for you, for example, is that a heart surgeon? They do the angiography in the operating room, send a catheter through the artery in your arm or thigh, and take an angiogram of the heart. Is that a cardiologist or a heart surgeon? Don't Google this one either. Just answer me. Answer without Googling, okay. Then I'll explain this to you again in a session. Well, I've only been able to cover internal medicine specialists so far. And then, if I want to talk about the subspecialties, hopefully that'll be in another session. Remind me if I forget. Write in the comments, hey, you wanted to talk about the subspecialties that come after internal medicine, for example, endocrinology, endocrinologist, endocrine diseases, pulmonology, gastroenterology, rheumatology, and, let me see, hematology, and many other things, nephrologist. These are all under the umbrella of these subspecialties. Please make sure to interact with me in the comments. Ask any questions you'd like regarding general medical knowledge. I will definitely prioritize the topics that get asked about the most in my videos. Hope to see you soon, and stay healthy.